So I wanted to tell you a little bit about tennis elbow. We've been breaking it down over the past week, and if you'd like to read our article about it, I will post it in the video description below. So tennis elbow. It actually has a pretty big medical name. Lateral epicondylitis. Yeah, I'll say it again. Lateral epicondylitis. You can see why we just call it tennis elbow. However, the name is actually pretty telling of what's going on in the anatomy behind the pain that you might be experiencing with tennis elbow. So I wanted to first talk about the anatomy and about why tennis elbow happens. And then secondly, I want to provide you with a stretch that you can do to alleviate some of this pain, of course, under the supervision of a doctor or a therapist. Here you see a picture of our humerus, the bone of our upper arm. At the very top is the humeral head, which is actually the ball portion of our shoulder's ball and socket joint. Lower down near the bottom, as we approach the elbow, you'll see the epicondyles. Your elbow has two epicondyles, a lateral epicondyle and a medial epicondyle. Today we're talking about what happens when the muscles that are attached to the lateral epicondyle become overused and inflamed. We'll tell you more about the medial epicondyle next week. So with tennis elbow, let's think about the action of your arm and your wrist while you play tennis. During an overhead hit, your arm and your wrist swing back, causing these muscles, so here's your lateral epicondyle, and these muscles right here, which attach to it, contract. When these muscles contract over and over and over again, over a long period of time, such as with tennis, but also with hammering or painting. There are a lot of different professions, screwing, that can cause just over contraction of these muscles. So when they contract over and over a long period of time, they can cause irritation right where they insert on this lateral epicondyle, right here. There are also often micro tears in this tendon that attaches to the lateral epicondyle. This area in turn becomes swollen, tender, and painful as your body communicates with you that something isn't right. Aside from pain, your grip strength can also be affected by tennis elbow. You might notice that you're dropping items more often, or that you're having difficulty managing items that you used to be able to just fine, such as heavy pots and pans. Your doctor or your OT or PT will perform several diagnostic tests to determine what exactly is going on. If it's determined to be tennis elbow, then most patients will recover without surgery, especially if they're attending a good OT or PT and adhering to all of the protocols. Now that you know about the anatomy behind tennis elbow and what causes this condition, I wanted to teach you a stretch that we often teach our patients that have this. However, please do not perform this without the supervision or the instruction of your doctor or your physical or occupational therapist, because doing this at the wrong time during your recovery could exacerbate the condition or further damage those muscles. All right, so because it's these muscles that are really impacted, oftentimes we want to stretch them out, help them calm down, help them become less inflamed. A good muscle stretch is often very good for muscle recovery. So this is probably the most popular tennis elbow stretch that OTs and PTs will use to help just stretch out the muscles, calm the area down, and provide some good relief. So it's very simple. You just hold your arms straight like this. Make sure that your shoulder's down away from your ears. I'll try to bend this a little bit more so you can see. And then if you have tennis elbow, you might already be feeling it like this. You might not even need to give yourself that extra stretch. So your palm down like that. And then you just pull it even more. I'm super loose, I'm super hypermobile. You probably won't get this much of a curve of an angle. You might be more like right here, or even right here. Whatever feels like you're stretching out this area. Here's my lateral epicondyle right here. And here is the muscle mass. You can actually see it in my tiny little muscle mass that I'm trying to stretch out during this stretch. You can hold it for 15 to 30 seconds and perform 3 to 5 reps. You can start slow and then work your way up to it. And if you're experiencing pain while you're doing this, then you should contact your doctor or tell your OT or PT that you're working with. With tennis elbow and with a lot of the epicondylitis or tendinitis or the overuse injuries, often the first line of defense is just to stop doing what you're doing that is hurting it. And you want to recover that way for a while before doing any of these stretches. But I hope that you found this video helpful. Please share with somebody who might be experiencing tennis elbow or elbow pain or forearm pain. This stretch is good for pain in your forearm or elbow that's also not related to tennis elbow.